All right. Hey guys, welcome back to Untitled. I'm Jenny Sharp with National Title Group. I'm so excited for my guest today.
Hi.
This is Elizabeth Hurley. She is the lead injector and co-owner of Prive Aesthetics, which is the med spa I go to. And I've known Liz for
a lot of years now.
Since 2017, I think. And let's just talk about our origin story.
Okay.
And we can just get all caught
Here
up
we go.
and talk about Prive. But I first went to you in 2017 because I don't even remember where I was going at the time before to get Botox, but I had tried out tear trough filler,
Yes.
which is the filler under the eyes. It's supposed to help with the bags. I used to have really bad bags under my eyes.
Yes.
And it looked really bad. And I don't know how to say it. It just looked really bad. It was too puffy. Like you could just tell I had filler.
Yeah.
Right?
It was just too superficial. It was pulling a lot of water. It was accentuating the bag. So lots of issues.
A lot of issues. And I'm even trying to remember, I was trying to remember earlier today how I even started going to you, how I found out about it. Okay, this is what I think happened.
I don't remember.
I think I found you on the Explore page of Instagram in 2017, just randomly.
Well,
and then I saw we had a lot of mutual friends.
Yes.
Jimmy.
Yeah. Yes.
Hey, Jimmy. You're
Hey,
not going to listen, but.
Cupcake here.
Yeah. And I think I may have asked him, and he was like, yeah, she's really cool. She's good. You should go to her. I mean, he didn't know personally.
Right.
But yeah.
Right.
He had been friends with you for years.
Yeah.
And
Took
honestly, I just took a chance. Which I don't even recommend today. It just happened.
Referral.
I didn't know what I was doing back then. But yeah, I was like, okay, I'll try, and it ended up being the best experience. You dissolved my filler.
We did.
And I think we tried it a few times again, but you ended up doing an amazing job on it. I just ended up being like, I don't want to do it anymore.
Yeah. Well, we had talked about it even going into it, like for you and your anatomy, that, surgery was going to be the best possible outcome for you, especially for the long term. And then I think we did film a couple times. Yeah. And then I think it was
it looked really good.
Yeah.
I just hated doing it and paying for it.
Yeah. Yeah. Well, there you go.
Yeah. And it wasn't for me. I have found out now over the years, I'm not a huge fan of filler on my face.
Yeah.
I do it.
Yeah.
Very conservatively
Very
because of
conservatively.
you. But I don't want it all over my face anymore.
Yeah.
I think I just look better without it.
Yeah.
And I actually think other people look really good with it.
Agreed.
And every face is different.
It is.
But that's how we started our journey in our relationship.
It did, seriously.
And I have been a loyal follower ever since. And it's been amazing. I will not let anyone else touch my face. And so I wanted you to come in today. Yes. And I also wanted you to come in because I do have people ask me a lot who I go to. Mm-hmm. And I just send ding ding. I just send them your contact card.
I appreciate that.
I say text her directly.
I appreciate
She'll get you
that.
hooked up.
Yeah.
And now a lot of people, friends, family, everything go to you. I feel like we're all like in a little inner circle.
Yes, it is. You get so close to your patients. They see you religiously, usually 3 to 4 months, and for a long period of time. I mean, literally 2017. That was like the start of I think it was a year and a half in maybe to my injector career at that point.
Was it really? Mm-hmm. Oh my God, I really took a chance.
Boy, did you?
Yeah.
No, I've been now doing it full time for I guess it's almost 10 years. So I guess I was a little more seasoned at that point. But I was going from ER and trauma to aesthetics.
Okay,
I was a good nurse. Like I knew what to do, and it was just a different realm for me. But you definitely took it early on, and thank goodness it worked out.
And it's just been perfect ever since.
So
it's been great. Well, and so you have that ER and trauma background, which I remember, I thought that's what it was.
Yes.
Okay. And I was going to ask, and that is what it was. But I knew it was something very, I can't even think of the word for it right now, but
intense.
A very intense nursing background.
Yes.
That's really good. And what I like about you is that you do your research on everything. So every new fad that comes out, if it's threading, the PDO threads or anything that comes out, you look at all the studies on it, see how long it's been studied, and you make a decision at Prive if you want to carry it or do the...
Well, I think that makes you a good practitioner. Again, this industry is built on the newest, the latest and greatest. And, these people, these companies, they hire salespeople for a reason. They hire good salespeople for a reason. That's how they make a lot of money. So, I really try to do my due diligence in the beginning, see if it's something we need to jump into. And then I just let it go to market and just see what happens. Because at the end of the day, you trust what I say, correct?
Yes.
You come in and I say, oh, Jenny, I think we need to do this on you. And I tell you all these reasons that this salesperson has told me this is why, the next, big thing. And then I do it on you and you're disappointed. Well, are you mad at the sales guy or are you mad at me? You're like, oh, exactly. Yeah. So at the end of the day,
I don't know who the sales guy is.
Right, exactly. So it's my word. And, I think of it from, if it were me, what would I want done? And my mind always goes to worst case scenarios. So I want to know everything there is to know about it. And again, these studies are pretty inclusive, but when you're talking about a subset of people and then the general population, a lot of variations happen within that. And so I think letting it kind of play out, see if it's the real deal. And, I was at a big corporate med spa chain and they, kind of jumped on these things and we would start and we would do it and it would fall short.
And you wouldn't feel comfortable
with it
either.
And so I would just, I'm not going to do it. And so you have to, and I think that came from my ER backbone. I'm just, okay. And I'm conservative in every way, shape, or form when it comes to aesthetics. So I think,
well, that's why I refer you to.
Yeah, I think I pick and choose what I think fits with the aesthetic in my mind, what I think my patients like, the general goal that I have for health, wellness, and beauty.
Yeah, no, exactly. And like I said, you do all the research and you'll tell me too. I'll ask about things that I'm hearing about around town because there are med spas that will, like you said, just jump on the newest thing. And
it's not always the newest thing. It may be a different technology that we don't have because there are things that I wish we could get for sure. It's just, we have to kind of decide what's the most important, what's going to be a workhorse for our, practice. And
those things cost a lot of money. So you have to be like, are people going to actually come in and do this?
Exactly.
Or are we going to lose money on this?
But I try to have a general knowledge base about what's out there, what's on the market. Even if, and what have I told you? I've never used it personally, so I can't speak to that. But this is what I've heard from my injector community. This is what I've read about. And then, my clients do with what they want to.
Yeah. And you do try a lot of the things that you have personally approved.
Yeah. Every single one of them.
First.
Every single one of them.
Yeah.
I don't do anything that I haven't done on myself in some capacity for sure. And then of course, we kind of put it into our friends and family, our moms, whatever it is, we try it on them first because they don't care to be the guinea pig. And then we see what happens before we even advertise it to our patients or before we even decide, okay, this is something we really want to invest our money in. Yeah. In our time.
And I think your brand as well is undercorrecting instead of overcorrecting.
Yes.
And a more conservative approach because you always say, you can always come back for more.
Yes, I can always add more. I can't take it away.
Yeah.
And if I take it away, it's usually more than
painful.
what we want. Yes, and it's uncomfortable.
Because
it's not a great experience. And at the end of the day, I would rather you come back and say, Liz, I love it. I liked it more when it was swollen. And then we get to that point. And then your maintenance, and then we figure out, and I tell all of my new consultations, and I mean, I've told you no. When you're coming into when you're coming into me
so many times.
When you're coming into me, it's a partnership.
Yeah.
You're trusting me with your face. I'm trusting you to do what I say. And then we have this agreement that if we get to a point where you walk in the door and I don't think you need it, you're walking right back out with a smile on your face that I said no. Because at the end of the day, there's a lot of bad examples of overdone. And, everyone has a personal, what they want from it.
Yes.
And it doesn't always align with what I think. And at the end of the day, and this is not the best to say, but aside from I'm trying to do what's best for you, you're also a walking billboard for me. So if I feel like you're walking
all the words right out of my mouth.
If I feel like if you're walking around Dallas with a crazy face
and people are like, who's your injector?
Right. Do I want you saying my name? Absolutely not.
No.
So it's a double-edged sword. I mean, again, I think
we are a representative of you and your brand and your skill level.
You're an extension of what I have to offer people. And so I think it's been so nice in my career at this point because I feel like attracts like. People that come to me for that reason. They come to me because they don't want to be overfilled. They don't want to be overdone. They want the conservative, anti-aging. And so that's what I try to offer.
Well, and that's exactly what I want for my face. I just got Dysport from you, I think last Tuesday or Wednesday.
I don't think it's in
so. And today is Friday, so it's been a little over a week. Mm-hmm. My face is still moving.
Yes.
but not moving in the way that I don't want it to.
Right, exactly. And
I don't know if I said that right, but yes,
it's
it's moving enough, but not too much.
right. We don't lose all sense of expression, but it's not causing the areas where the static lines would form on your face.
Yeah,
And that's the goal. I mean, frozen's not the goal. The goal is to keep you from getting fine lines and wrinkles. And so allowing you enough expression to express yourself, but preventing those lines.
I want to look like myself, but better.
Yes. Well, just a little zhuzh.
Despite what an ex-boyfriend texted me once.
Oh no.
It was my Alexis Bell episode. I'm going to repeat it. Arturo's like, yeah. He saw me on Hinge or something.
Oh, no.
And I think I had filtered my face too.
Jenny.
Through the face app, it might have been too much.
Jenny.
And he goes, "You've got a lot of work done."
I need to know. Listen, I need to know which filter you picked though.
I always pick Kiss 2 on the face app. And I think just that time.
You went with the Hollywood.
No, I've never done Hollywood. I do it for fun, but I don't post it in public.
Okay.
It's always Kiss 2 or it's Kiss 1. It should have been Kiss 1.
Yeah.
It should have been a Kiss 1 but he goes, "Yeah, you've gotten a lot of work done, huh?" And I was like, I haven't talked to you in 7 years, and this is the first thing you say to me. How dare you?
Right.
But he was wrong.
Yeah.
Because I think I look great.
You do. I'm with you, sister. I do too.
I was like, I put a lot of money and time into this.
You do. And consistency is key. And you hit the nail on the head with that. You come in when you're supposed to. And
yes, I do keep up
sometimes
with
when
it.
you're not.
And you do tell me to turn right around and go home
Jenny,
sometimes.
Go.
We need that.
Get out of here.
Go.
I know you like to see me all the time, but just shoo.
But I'm glad we have that relationship. And I hope everyone else has that with you too, who goes to you, because I need to be told, and everyone needs to be told no, because
I need to be told no.
What is that term called, by the way?
Well, you just think about, body dysmorphia is like the worst case scenario.
No, but there's a term. I think it was on Chestnut MD, the plastic surgeon.
Yeah, I know who you're talking about.
Yeah, I think you told me to follow him.
Oh, yeah, I really did.
He made an Instagram reel recently, and there's actually a name for it in terms for the injections. And it's like body dysmorphia, but it's for that. Tanorexia, you know? You don't know how tan you are.
Well,
so
and
now
I think
it's something distortion, I think.
Yeah, I mean, it's definitely. And when you think about what you see in the mirror, what you see in the mirror is not what the objective world sees of you. Everyone sees themselves differently. You look at yourself completely different than what I look at you. And so if I tell people everyone's like, well, do you inject yourself? Well, absolutely not. If I had, access to these syringes and one day this wrinkle bothers me and I take care of it, I'm going to look like the cat lady real fucking quick.
There are injectors who do inject themselves.
Agreed.
I've seen it.
Yeah.
So.
It's not safe, first off.
I don't think
aside from, again, not being able to view myself from a different perspective, it's not safe. So have I touched up my Botox? 100%. Like that, I mean, if I mess up my brow or I make my lip wonky, okay, I blame myself. Fillers, stuff like that, I just don't think it's the risk isn't worth the reward, in my opinion.
Yeah.
So.
No. And in terms of your undercorrecting versus overcorrecting method, I will say I have gone to other injectors, obviously, because I had gone to another one before I saw you. And I've even had really well-known, like even a well-known plastic surgeon in Dallas who was doing masseter Botox on me because I have TMJ. I don't do the masseter Botox anymore, but we've gotten to a point where we think it looks better without. Yeah. But he did it and he hit a wrong muscle and I was smiling like this for 3 months. And then I went back in and I told him what happened and he made a joke about it.
Yeah.
And he made light of it. And I was like, buddy, I'm in sales.
Right.
I'm showing up to lunch meetings.
I mean, that is one of the possible adverse, reactions to that specific treatment. And I will tell you, not
especially when it's right up here.
100%. There's a safety zone and some people get a little heavy-handed with, where they think it can be placed.
Yeah.
And, they're surgeons and they know what they're doing. Sometimes less is more in a lot of the situations, in my opinion.
Yeah. Is this
and
whole
conservative
podcast
treatment.
just going to be me talking shit about other people?
I don't know, but I'm trying not to talk shit about
I know.
I'm like, I know. Think. What can you say without pissing everyone?
Okay, I won't say anymore. I've already talked about my ex. I talked about a plastic surgeon, another injector.
This is just a talk shit thing today.
This is my pod. This is my brand.
Yeah. Who else?
Your brand is undercorrecting. Mine is talking shit on company's time. So
I mean, I'm not mad at it.
Yeah, well, So let's talk about Prive and how it got started and, what year it was and how it came about. We don't have to go into all the detail, but
I mean, the brief overview.
Yeah.
Prive was an existing med spa off of Knox Henderson, and they had been around. We've been functional with our new rebrand, me being a partner for, it'll be 3 years next month.
Okay, yeah.
So they were an existing med spa for 3 years, give or take. And I was working for a corporate med spa chain. I'd been doing that about 6 years for them, 6.5. So I've been there a while. And we both were just kind of stagnant in what we were doing. I've known my business partner 10 plus years. She's from Oklahoma. We had mutual friends.
Yep. Hey, Candace.
Hi, Candace.
Love you, girl.
And so we, it had always been an open conversation as far as, it was always like, well, you can always come over to us. And we'd never really thought about mixing business and friends. And so it was, at that point, more of an employer situation. And I enjoyed my day-to-day at my previous place. I loved the people I worked with. And again, it just
the timing seemed to match up around 2020.
Right. So. And so honestly, we were drinking wine and just kind of talked about it. And, it was like, and it just seemed like, it was just like one of those moments where it's like, okay, this might be something we really want to look at. Yeah. So we did. It was a drunk decision. Yeah, it was. I was like, okay, let's put this down and we'll talk about it tomorrow with a clear head. And so we did. And, we decided, that we would set parameters to our friendship and parameters to our business. And
that's really smart.
We did. And, we brought, both of our husbands in, and they kind of played devil's advocate as far as like what's going to happen? What if this happens? What are you guys going to do? And we'd already done the same just within our friendship and within our, what we could think of. Neither of us had ever owned a business. Neither of us had ever, but we both had partners that had, different.
That's good.
Yeah. And different businesses, and had a lot of situations that have happened with partners and things like that. So we were able to walk through a lot of those things. Now we can't predict the future and we can't predict everything, but we looked at to the point
so
where
far so good.
Yeah. Like, what happens if I break my arm? Like, what happens if, someone gets a divorce? We went through a lot of things that you don't want to think about. So I think we went into it pretty prepared as much as we could be. And so we rebranded, opened our new clinic, and just kind of took off from there.
Tell us where it is now.
It's over off of Hillcrest, in between Mockingbird and Lovers, across from SMU.
Yes, right next to Snyder Plaza. Most importantly, next to Chick-fil-A.
And by Chick-fil-A.
That is always busy and taking up parking spots.
Well, we're about to be real screwed because they're putting a Starbucks in there. What? Yes. Where that SMU t-shirt, right by Chop Shop, where that t-shirt place
where they sell all the sorority
stuff?
Yeah,
so
that place is going away?
Yeah, it's gone. It's been gone. Yeah. So I think that family finally retired from it, and they just put a Starbucks sign in the window.
Oh no.
So you think there's no parking now?
I can't say that. What if they want to sponsor me?
I'll take it.
Just kidding. No one wants to sponsor me. If Starbucks is listening,
we'll take it.
Aside from the 5 listeners that I have right now, I'll take it. Thank you.
But yeah, so yeah. Starbucks is down the street now, or about to be.
I love the location.
I do too. It's
really close to right here in my office.
Yeah.
So.
We tried to kind of figure out what would be close far enough away from my previous location that it would not be stepping on toes, but also convenient enough to the highways that my patients were used to, because I do have.
And where do they live? Where are they coming from?
And they are. And a lot of them come from outside of Dallas proper. They're coming from Prosper. They're coming from Rockwall. So. They're coming from Plano, so they're traveling. So we did put some thought into where we could do it. There's not a lot of real estate to purchase, commercially in the areas that we wanted. And, we were pretty adamant that we wanted a storefront, which makes it narrows the pool even more. And so, we've got a little while longer in that location, and we're trying to figure out what our next move is as far as what we're going to do location wise. So.
Okay.
Parking lot is definitely one of those things that is on the must-have list. Okay. So we're trying to.
You always have to think about that, because that area is just very busy.
It is,
which is good.
It is, and I think it's given us a big presence in the community. It's been convenient, easy to find. Yeah, lots of positives. Really, the only negative is the parking, and there's just nothing we can do about it. We've tried.
No.
We've tried to buy parking lot spaces from people just so we could have dedicated, and it's just.
You're just going to have to start paying for people's Ubers.
I'm
just kidding.
For business expense, I guess.
Yeah, you're like, wait.
I mean, I can't tell you how many times I've seen the little Uber drivers and they will park in the spot. They don't even have an order. They are sitting there morning, lunch, and dinner because we have Chick-fil-A, we have Pizza Hut, we have Chop Shop, we have Jimmy John's. So they know something's going to hit if they sit there for long enough. I've caught them taking naps in their cars. No. I'm like, move it. Like, this is our parking spot. I get, yes.
You tapped on their window?
Yes, hell yes, I did. Usually if you just stare long enough, like, and look real hard, they'll eventually move. Now they kind of know because it's kind of the same group of drivers. So they kind of know.
Yeah.
You know, if it's an in and out, we don't mind. But, you know, you can't sit there for 30 minutes and take a nap.
Well, that's very inconsiderate.
It is. It says patient parking.
Yeah. Well, but that's off to Uber.
Yeah. Right. Yeah. Well, and there's just no recourse other than, again, knocking and being like, hey, can you move?
Yeah.
But,
well, you'll figure it out.
Yeah. We're doing it.
Should we get into some questions and answers?
Sure.
Okay.
Yeah.
So about a week ago, you know, the 5 of you who are listening maybe saw me put out an Instagram story, a Q&A for Liz. And I have it right here on my phone. So let's get started. Where is it? Oh, it's in my favorites album. So we'll start with, for men, under eye bags and Botox. Maybe he's asking Botox in general, and then obviously what to do about the under eye bags.
Botox in general, I mean, obviously a lot of men prefer to have Botox around the crow's feet. A lot of men smile a lot. They golf. They do all outdoor activities. They have a lot of sun exposure. So yeah, most men aren't super concerned. I mean, some are, some aren't. But a lot of people, you know, kind of start worrying about the eye area. So Botox is definitely an option in most situations to help with fine lines and wrinkles and contraction of the muscle. As far as under eye bags go, that's definitely a case-by-case basis, depending on the severity of the fat protrusion, the laxity of the skin. You know, there's a whole bunch of parameters that we kind of look at to determine what's the best approach. Yeah. You know, resurfacing, radiofrequency microneedling, if it's a pretty underwhelming case, you know, if it's leaning more towards the extreme, I usually recommend it, you know, a lower blepharoplasty. Yes. I tell people all the time, you know, this is the scale. If you're on this end of the scale, I can usually do something really good about it. If you're on like even middle of the road, we have a strong conversation about what this looks like for you financially, what, you know, how often you're coming in for treatment, you know, what the possible outcomes can be and what can happen in the future versus are you okay with surgery? Is that a hard yes, hard no, you know, and then we kind of make a decision. When you get to this end of the scale, it's usually a hard no, don't touch it, don't waste your money doing those kind of things. Here's a really good oculoplastic surgein. Yes. So I think that
shout out to Dr. Verchek.
Yes, Dr. Verchek, we love you.
VRCK.
Yes. And so, you know, it's definitely a consultation required situation, but Botox for everyone is usually in some way, shape, or form very justifiable.
Always a good idea. Yeah.
Yes. A must for me, but.
Well, and this wasn't on the questions, but since we're talking about Botox, tell us the difference between Botox and Dysport.
Yeah. So they're basically two different manufacturer, you know, neurotoxin.
And the other ones too.
Yeah. There's a handful.
There's new ones that have come out.
There are.
But Botox and Dysport are the main.
Yes. So they're all very similar as far as function. You know, the carrier proteins and the way they act in the patient are a little bit different. We carry Botox and Dysport. You know, I tell people it's kind of like Coke and Pepsi. You can either drink them both or you feel real strong one way or the other. And I feel like that's kind of the situation with, that's kind of the situation with these. Personally, I go back and forth. It depends on the day or if I have an event coming up. You know, I can't tell a big difference. Some people feel like, you know, there's a hard, you know, one way or the other for them.
Yeah. And the units are different.
They are. And that's just kind of arbitrary. You know, recommendation, like we're talking about the glabella, which is like the frown lines here. You know, Botox recommended start dose is 20 units between the brows. If I were looking at Galderma and Dysport, they're going to say 50 units between the brows. So they're just different units of measurement. You know, obviously there's different ways that you can reconstitute it as far as fluid volume. Mine's very...
Dysport's always more units.
Yeah, it takes usually
still
two and a half.
It's the same.
Yeah. So, well, I don't want to talk shit on Galderma. Anyway, so I think they just were like, oh, if we make it this unit of measurement, and in your mind, you're hearing 50 unit, you know, I think it's a great marketing strategy. That's a very just in my head conclusion about this.
Yeah.
But it takes about 2.5 to 3 Dysport units to do what one Botox unit will do.
Okay.
So fluid volume for the way I reconstitute it is the same as far as the amount of fluid that gets injected.
Yeah.
The active molecule is a little different.
And doesn't Dysport one prick will spread more?
It does.
Than
It
Botox
disperses
does?
a little bit larger, which
so you have to,
adjust the placement.
Yeah.
And Dysport usually will kick in a little bit more. A little bit sooner. So a lot of people will like that, you know, a little more immediate onset. It still can take 2 weeks for everything to, you know, level out, that kind of thing.
Yeah.
And then everything else is just a variable on dosage, duration, you know, muscle strength, you know, that kind of thing.
So I did Botox for, I want to say 6 years. And then I felt like it just started wearing off at about the 2-month mark. And I asked you about it and you said, well, sometimes, you know, your face can get used to something. So maybe you have to switch off from time to time, which makes a ton of sense because I do it with skincare. I do it with shampoos.
Yeah.
I do it with everything.
Your body gets used to that same structure. So you mix it up a little bit. It's kind of like a shock factor. And like I said, I tend to go back and forth because I can't tell a big difference. Some of my clients only want this and they only want that. And sometimes you just need a little bit more, you know, your frequency
you're older
is different.
Now, so you maybe need more.
Or, you know, your body reads it just like any other toxin. You're trying to flush it out. And if you're being more active in your health regimen or your detoxing, you know, hormones, you know, there's a lot of variables internally that I can't predict looking at.
Yeah.
From
If you're
outside.
drinking 32 ounces of celery juice every morning, like I am, maybe that's why the Botox
Good
is
for
just going away.
I tried a celery juice cleanse for a while and
I'm still doing every morning 32 ounces.
That's insane. I mean,
it's time consuming. Yeah. It's expensive, but it's nothing to be proud of.
Getting up in the morning and having to do that, and that's a lot.
It is.
Yeah.
We don't need to talk about me.
Yeah. Okay. Yeah. We won't get into what else can be going on. 32 ounces of
really
celery
bad.
juice.
Yeah. I mean, I love it. It has great health benefits, but it is a lot.
Yeah.
But yeah, maybe, and I do metabolize things quickly, especially filler.
Yeah.
I don't know. Do you have any patient that metabolizes lip filler more quickly than I do?
I mean, your lips look great. You think you
They look good now.
metabolize it, honey. No, you don't. You just need a little adjusting. That's not metabolism.
Okay, so the normal like lip refill, we'll call it, is what between 6 months to up to 2 years, right?
Well, no.
I know people that are like, I haven't gone in 2 years, and their lips look like they just got freshly injected yesterday.
So it definitely depends on where you start. Okay, what your lips like to start. The quality of your lip tissue. Okay, so if you have a lot of fine lines and wrinkles, it can take a lot of lip filler to get you full and to keep it there.
Yeah.
And then how much you move your, things that you do with your mouth, that can definitely play into it. But it depends on the product type. There's just so many, and how much you start with and where you're going. If we're still in the building phase, you have to do that more frequently. Once you get to maintenance, most of my clients are somewhere around 6 to 9 months. But again, I usually do it, and this can get some shade in the industry. I do a lot of half syringe.
We only do a half on me because
it would be too much for your lip.
Yeah. And I swell so bad. Like, we've tried it before, and I have to basically not be seen in public for 3 days. I look like I'm having an allergic reaction on my lips. I don't know what's everyone's different. That's what it is. So half at a time. And then I go like around 4 months.
Yeah, you come in every 4 months. I don't let you do your lips every 4 months, but you come in and want it.
Yes. Again,
she wants it.
She
doesn't
tells
need
me
it.
no,
Yeah, you think you come in every 4 months for lip filler. On average, you're probably every other Botox or every third. So 6 to 9 months because you're in the maintenance phase. And yours isn't really for volume. It's more because to fix the asymmetry from, again, that can be muscle movement of the mouth.
Yeah.
That kind of stuff.
I have natural asymmetry and then it just will deflate a little bit.
Right.
And I miss the, Brittany, who's your office manager, she said someone came in, what did they call it? Something Crispies.
Oh, who knows?
It was like the crispy edges
Yeah.
or something like that. And I'm like, that's exactly what it is. It's crispy edges of your lips.
Yeah.
And that's what I miss too.
Yeah.
Whoever you are out there, lady, you hit the nail on the head. That's what it is.
Well, I'm going to have to ask Brittany tomorrow what she was talking about.
Yeah, it might have been crispy edges.
Yeah.
So it was good.
Who knows?
Okay, so we'll go on to the next question. I'll answer this.
Okay, I'm nervous. I'll take a drink.
Your wine's over there, by the way, if you want to get it.
I drink it all.
Why do girls feel the need to inject their lips so much that it looks like they got punched in the face respectfully? Haha. So this is what we're, Chris. I swear to God. I'm calling all of you out by name, by the way. And that's what we were talking about. It's that, and I wish I had looked up this reel again. It is something distortion.
Okay.
It's that tanorexia.
Yeah.
It's that body dysmorphia. It's that you think it
looks different than it is.
Small and it's not, and you want your lips bigger, and that's just what it is. And that's why you tell me no.
Yes.
And that's what you need. But
yes,
if you have an injector who doesn't tell
too,
you no, then you will look like you got punched in the mouth.
And I will say this too, unfortunately Dallas has a lot of bad examples. And I think men especially, I mean, women too, but men remember that. So when my patients come in and they're like, my husband doesn't want me to do this. Like he just does not want me to look like that. And I'm
Girl,
like,
leave him.
I'm like, it's because he's thinking of all the worst case scenarios. He remembers these people that he's seen. Little does he know that half the people that he just sees and finds attractive has had some variation of these injectables too. It's just done correctly.
He'll point to a woman and say, I like that. I like a natural looking woman.
Yes, and she's had
Botox
stuff
and filler and everything
They just think of the worst. And I mean, think we don't do that.
No, you don't. So, Chris, I hope that answered your question, Chris. Here's another one. This one's it's just like the other one.
Okay.
Are injectables healthy, or is it snake oil designed to keep women coming back for more? This is from a man who has not had any injectables done.
Okay.
So that seems like a natural question from someone who does not know about them at all.
Yeah, that's fair. I mean, when you say healthy, I mean, I think anything you're putting in your body, you have to, weigh the risk versus reward.
It's not celery juice.
It's not celery juice. No, it is not organic. They're not. We do have some new options that works. We talked about it, the Easy Gel. There are some options that are more natural. Now, when you think about it from a mental health perspective, I do think it can be a healthy outlet when it's done right, because it makes people feel better. It makes them have more self-confidence. It makes them, do a lot of things that they may not normally do.
Yeah. In
now,
terms of physical
health, I mean, it is still foreign to your body. That still comes with risk. Again, you evaluate that with your practitioner and decide if it's a good option for you.
Exactly. What was I going to say? Oh, okay. So, these last two questions were from men, and you were saying that they, men tend to say, oh, maybe they want a more natural look. They don't want their significant other getting injections, and then they don't realize they're getting them. So what are the more natural looking injections, or just do we call them procedures?
When we do any consultation, we don't start full force, oh, you need filler. I mean, it is a very multifaceted conversation, and it usually starts with, what do you use on your skin? That's something you can do every day at home that isn't going to augment your reality. It is just going to help to improve the texture, tone, tightness of your skin at home. Then we can talk about, if we're not wanting to get into the injectable realm, there's lasers, there's microneedling, there's a whole plethora of things that don't involve changing the shape of your face or the movement of your face. And then we can kind of start talking into some of those options if that's where you want to go. There are biostimulatory products, things
Sculptra.
Sculptra's one, Easy Gel's one, PDO threads are some, and there's Radius, which we don't carry. There's a bunch of them that stimulate your immune system that causes more collagen and elastin formation. So those
I'm liking those more now.
I think it's the way of the world. Everyone, again, that question, just for example, people are more apt now to think about what they're putting in their body, whether it's post, COVID and, whatever it is, people are more aware of it. They're asking questions about it. And I think, we've brought on this easy gel alternative because
which I'm going to try.
Yeah, I'm excited for you to try.
Maybe within the month, or because I've already done PRP.
Mm-hmm. So it's a play on PRP. Okay, it's platelet-rich fibrin, so it's just kind of an elevated growth factor plasma from your blood.
Yeah, and I love PRP too.
It's spun down a little differently. There's 0 additives in the tube. And now we've even kind of advanced that further where we can make a filler of your own blood product. So we take that PRF, we heat it, cool it, do this chemistry experiment, and it becomes a filler that gives you that immediate gratification of a traditional hyaluronic acid filler.
Yeah,
but the delayed release growth factors of like a Sculptra or a PRP. So I'm excited. My patients are loving it. I think, again, as we, the shift kind of goes more towards a holistic, functional, health system.
And even just the look of it.
I agree.
It's different.
It is something, again, it's been out for a while. I've just been kind of watching and see because
I love that.
In theory, physiologically, it makes sense to me. Now, whether it performs as well as some of the other alternatives on the market, that's where I had to kind of see, what does it look like? What does it look like in 6 months? What does it look like in a year? So everyone so far has been super excited with it. Everyone's been really pleased with it. Again, I'm conscientious about, the things that I put in my body for the most part, or I at least try to be as much as I can. Besides, the wine over there, but I do think it's important to think those things through. And again, if I can give you that in the beginning and then still give you something that's going to continue to produce collagen, elastin, and improve your skin, I think, that's the way to go.
Yeah. And, like I was saying at the beginning of this episode, that I have been favoring other things more than filler lately. And that's Sculptra is one of them. And PRP, which I've been done under my eyes. I've done in my marionette lines around my mouth. I've done in my neck for tech neck lines. And I've done filler previously in all those places. Yeah. And I just like the look of the PRP better. So I'm excited to try the Easy Gel, that it's even a step above with more hyaluronic.
It's not hyaluronic, but sorry. Visually, it will look that way.
It looks more hyaluronic.
Yes. Yeah. Visually, that's what you're going to feel like you've had a good hyaluronic acid filler treatment. Internally, it is actually just your blood product and your albumin gel, if you want to get really nitty gritty about it. So it kind of acts like a scaffolding that supports the dermis, and then it is infused with the PRF we mix it with. So that helps to delay the release of those growth factors, which is going to help the skin. So it helps stimulate collagen elastin.
I'm excited. Yeah. Let me see. Okay, we have more.
Okay.
This is from a man, but I think that
apparently a lot of men are on your Instagram, Jenny.
All 1,000 of them. Yeah. Just a lot of men, I guess. Yeah. We're asking questions.
Let's go.
But this would be for a woman too. This just happened to come from a man, so you can.
Well, and I think too, men are more resistant to walk into a med spa and ask these questions. So the fact that they can do it behind a keyboard.
A woman would have to drag them in.
Right, exactly. Yeah. So, I'm glad they're asking questions.
I know.
Hit me with it.
And I'm not saying their names unless you're Chris and you asked about being punched in the face. Can they help me with my jawline? Yes. And it's from a man, but again, women do it too.
Yes, absolutely. Traditionally, it's going to be more of an HA filler, just so we can build out contour, kind of mimic the bone structure. What brand is an HA filler? So Volux is FDA approved for the jawline. That's what we use commonly in our practice. Voluma traditionally was kind of before that. Radius is an alternative. I don't use that personally, but I've seen great results with those.
And you said you don't have Radius.
We don't. Okay. Yeah, it's a little different. It's a biostimulator like Sculptra, but has a little bit of oomph like an HA.
Okay.
It's,
Can you use it in your lips?
No.
Okay.
No, it kind of mimics like a bone. Now they do hyperdilute Radius and all kinds of crazy areas on the body.
It's hard to keep up.
It is. And, you can only expand your horizon so far. And again, we have Sculptra and now we have Easy Gel. So I just don't see it as a need for me currently.
Yeah.
We've been happy with the things that we had now. But yes, jawline can be contoured. It usually takes multiple syringes. Again, consultation required depending on the severity of, the recession or what we're working with.
But
and you
have to be conservative with it. I've seen some crazy ass jawlines walking around this town.
Yes. It's so funny because
I don't know why they think it looks good.
As things start to trend on social media, they just come in. This is what they want. This is what they have these pictures and you see this really beautiful woman with this chiseled jawline and they have this like one angle. And they're like, I want this jawline. And I'm like, okay, well, have you seen
them in person?
Well, not even in person. I'm like, have you seen them in a video? Have you seen them talk? Have you seen them look straight at the camera? Because then they have a square horse face because they built out this entire jawline that they didn't need. Yeah. Now, if you want to accentuate it within reason, of course there is wiggle room within reason, but not everyone needs this super sharp chiseled jawline. If you have a deficiency, there's things that we can do.
Yeah. Like I feel like I could definitely get some, but I don't want it. I don't care.
You don't need it. Here we go.
This is what we go through every appointment.
Literally. She comes up with a new idea and I tell her no.
I'm like, well, what about, I just said I don't want it.
But then you just said
I said I could use it, but I don't want it. It's not important to me.
You don't use it. You couldn't use it.
You know what? We'll talk about it later.
Yeah,
I'll talk about when I see you in 2 weeks.
She's going to come tomorrow and be like, I'm going to talk about the jawline.
How do you fix botched jobs? And I guess there's many different kinds of botched jobs. Maybe botched lip filler, botched Botox. Yeah. And I know that, again, since I've been going to you since 2017, I do know about you that you do get a lot of people coming in from other injectors with botched jobs that you have to fix.
Yeah.
And that you do fix and do very well with it. And so this is kind of an expertise.
Area of expertise it's a case by case basis. You know, I do get people that come in with complications. Yeah. It's not always the injector's fault. It's not always the patient's fault. It's not, there's so many variables that go into, producing a good outcome. And, we have patients that go from injector to injector to injector. So you never know, and some people just don't know. Yeah. Depending on the area, some things are dissolvable, as far as toxins, sometimes it's just, I'm so sorry, we have to wait for it to fix itself. Yeah. Well, like Botox. Yeah. I mean, there's not much you can do, right? It depends on what we're talking about. If it's one wonky eyebrow, I can usually fix that. If it's a crooked mouth smile, you got to let that wear off because the risk of me trying to fix it could be worse than where it's at. So it's a case by case basis. It's not always reversible. In the case of Botox, I typically sway more towards reversible, fillers with the exception of Sculptra, Easy Gel. That way, if there is a bad outcome or adverse reaction, I can get rid of it personally. Well, and the good thing about Botox and Dysport is it's not permanent. A lot of it's going to wear 3 months. Yeah. So, and a lot of times if you get an adverse issue, it's usually not a whole dose of the wrong, it's not, if they're putting 20 units in your well and they get it wrong, it's not all 20 units making it wrong. Okay. It's usually just a couple that deviated to a muscle that they didn't want to hit. So usually it'll wear off, a month and a half or so for the most part, depending on how much they're using and how incorrectly. Okay, good to know. But yeah, it's not always the injector. Some people go home and they do things that they're, advised not to do. And there's a reason we give you a set of rules. Go upside down within an hour of Botox. Yes. And we can't sit you in a corner and say, stay here for 4 to 6 hours. Let me make sure that you do it right. So again, that's where the partnership comes in. Yes. I inject you, you do what I tell you, and then we all live to see another Scout's day. Honor. Yes. Yeah. Like you uphold your end, I'll uphold mine. That's it. Another question. What's your favorite skincare lines? Oh, so I've used a lot of them. I will say Skin Better Science is kind of my top go-to for a lot of different reasons. I've been carrying and using them for probably 8 years. No. Probably like 6.5, 7, somewhere. And what's crazy is I don't think I've ever tried it. Isn't that crazy? Well, you try a lot of skincare. We talk about skincare a lot. Yeah, but I don't even know why. Yeah, it's one of those things that you get a lot of patients that come in have no idea where to start, and so are there more robust skincare lines out there? Of course. Are there more aggressive skincare lines out there? Yes. I think as far as an entry level medical grade, and not even just entry level, I've been using it consistently, and that's all I've used in that amount of time. And I think that it's formulated a little differently. It's formulated with neuropeptides, but it's an easy transition from not doing anything to being able to have great skin with just a few steps. And there's not a lot of regimens that can be used that way. And it's a good price point. It is for medical grade skincare. It is. It's a decent price point. I mean, they're all expensive, so you just have to know going into it. And that's where you just dial in what's most important to you, what's going to benefit you most. And then we kind of pick and choose what works. And when we kind of integrate new skincare options.
I like to mix like some
sometimes
drugstore
it's good to
things
switch
with,
it. It's sometimes, and I tell people, what face wash you use, figure it out.
I use
like
CeraVe.
what? Yeah,
Is
what
it CeraVe or
moisturizer?
CeraVe?
CeraVe, I think. But moisturizer, you can use. You can pick and choose.
I use Vanna Cream moisturizer at night.
I might have a preference for you, like depending on what your skin looks like. But is that the end all be all? No. A good retinol, Retin-A, absolutely. A good vitamin C, absolutely. A good under eye, absolutely. A good sunscreen. Those 4 things, those are the ones I'm pushing to you to use. Because those are the things
and
that
I use all of them.
Yeah, those things are going to make changes to your skin. They're going to benefit you from now until forever.
Yes.
Everything else, if you're acne prone or you have rosacea or you have dry skin, I can implement and plug in things that are going to help based on that foundation.
Yeah.
But I would say Skin Better is my favorite. There are a few revision products that I like.
I like their vitamin C serum.
Mm-hmm. And there's another, I can't even remember the name of it. There's another eye cream that's a retinol eye cream that I'll plug in sometimes. So there's, and I try stuff, if I, am out of stuff, I keep hearing some buzz about it. I'll try stuff for a little while. I seem to always go back to Skin Better though, to be honest.
Okay. Well, that says a lot.
And I used to be a really big SkinCeuticals gal. So
yeah.
And I tried Obagi.
I like their moisturizers.
Yeah. I tried Obagi way back in the day, about the only one I haven't tried that I would be.
Oh, Obagi's good, right?
Yeah. So is Zeo, I've tried some Zeo products, like a few, but I've not done the whole line and the whole regimen. That would be something I would be interested in like looking into at some point in the future. But those are like, that's a hard commitment, skincare.
And there's
like
a lot of good skincare too.
Yeah. And if you're going Zeo, you're in it for the win, you're in it to win it. So.
Yeah. Okay. That's good to know.
Yeah.
Let's see. Best treatment for jowls.
Okay. I've
been on a journey.
Yeah. Yes. So gels are tricky.
Yeah.
Okay. Consultation, again, very important. We got to figure out what's causing it, and it's, again, multifaceted. Genetics play a huge part. Skin tone, texture tightening, weight in general, support through the mid face and kind of the lateral zones of the face. There's a lot of variables that go into that. Dentition, the way you chew, that can cause you to kind of have pockets in that area.
Yeah, and some people are just more jowl heavy.
They are, and that's
I'm
genetics.
More jowl. Yeah, it just is what it is.
There's different options. Radio frequency microneedling can kind of debulk and contour the lower face. We kind of use that in the beginning, and then we can go depending on, again, the support needs of the face. We kind of look to that after that. Obviously, we did Kybella into your jowls.
And it worked really well.
It does. That's the only place I really like to use Kybella is that area, because I think it's beneficial with usually it's one treatment and it does a pretty good job, and then we kind of utilize other modalities to finish.
But isn't Kybella like originally supposed to be what is this area?
Submental fat.
Under the chin?
Submental fat.
Which we did that to me once and it was so painful.
Yeah.
But then when we did it on the jowls, it wasn't.
Yeah, it's tricky. I don't really like to use it submentally. I think if I have to do that many vials and that many treatments, I'm going to send you to get in-office liposuction of the submentum, because for that many downtimes and that, comfort level, I think, and the money,
price?
The money that you're putting, I think you at least explore that route. If you're not ready to do that, then, and we have True Sculpt, which has been great for us. That is an external radio frequency that kind of breaks down the fat cells. And in that area specifically, it's been really, really effective. So I think between all of those, we kind of pick how committed are you to the process. We kind of map out, let's try this, and then we reevaluate. Let's do this, and then, we kind of see where we are.
And this, we've talked, I recently got ULT therapy.
ULT therapy.
ULT therapy.
Yeah, say it right, Jenny. You pay a lot of money for it.
We don't need to say the right name. I don't have good things to say about
it. I'm taking it you didn't love it.
And you told me, I talked to you about it. You told me it's basically 50-50. It's really expensive.
I feel like
people either love it or hate it.
Yes, that was the feedback, and that's another treatment option that I've not used personally.
Yeah.
I have the feedback that I've gotten from my clients that have tried it, from practitioners that I respect, it's people either love it or they hate it. and they either feel like it was the best thing they did for the money or the worst thing.
Yeah.
So there's no in between. I couldn't give you personal guidance on if you were a great candidate because I've never had my hands on that machine. So I said,
I don't
go
think
see
I
what
was.
you think about it.
Is this thing on? I don't think I was a good candidate.
I think I did say that to you.
I think you did too.
Did I not say, Jenny, I don't think you need to even do that?
Yeah.
And you did it anyway.
But I did it anyways.
You could have given me the $3,000 and we could have at least had fun together with it.
It's really expensive and it was the most painful procedure I've ever had done. And, they numb you with like lidocaine or something, and then they give you laughing gas.
Pronox.
And I've never inhaled so much laughing gas in my life. I was going, oh.
They're like, Jenny, lay off.
And I was like, just let me know when you're doing it again. I would take like 5, and then I would get so high. And then I'd be like, ugh, and it was so painful. And then they would run out of the laughing gas while she was doing it.
No.
And so she would get the nurse to refill it, and then she'd be like, you should be good for the rest of the time. And then I wasn't because I was doing so much.
So they have like a hard stop.
They kept having to refill it. No, they just kept having to refill the laughing gas. And I was like, it was making my legs just like jolt, like up. And I have a really high pain tolerance. So I couldn't even believe how bad it was. And then she said, you really won't see results until 3 to 6 months. It's been 3.
Okay. And how are your results?
I don't think I've seen any results from it. I've heard from other people again that they really liked it.
Right.
I think
maybe
I wasn't a candidate, and the person I went to, and it was not obviously at Prive because you guys don't do that there.
Don't do that. You're right.
Oral therapy, whatever it's called. Maybe she should have told me I wasn't a candidate if she thought I wasn't. We didn't really discuss if I was a candidate or not. It was just like, do you want to do this or not?
Yeah.
Like, I can provide this.
And it's...
So that's my bad. Sorry.
It's not my money, honey.
Yeah. It was mine, and I'm sad.
We could have had a lot of fun with $3,000, Jenny.
I could have done a lot of things.
Yeah, we could have made you forget about the fact that
We could have gone to Mexico.
Right. We could have gone on a trip.
So, yes. All that to say, everything is case by case.
It is.
Like you're saying, you have to evaluate the patient.
What's right for you is not going to be right for everyone. And what's right for them is not going to be right for you. So that's where it becomes having that level of trust. You have to find someone that you correlate with that has the same ideas that you do about aesthetics and your health in general. And then you stick with it.
Yeah.
And listen.
Okay.
When they say it.
I think I listen to you most of the time.
You do.
So.
You do. You've come a long way from.
Thank you.
Yeah, you've come a long way.
Thank you. Okay. One more. Well, I might have 2 more questions. Okay. I have to find the other one in my DMs because I didn't screenshot it. What's a good one to boost your collagen and look refreshed? And it's a 2-part question. That's the first one. So we'll answer that first.
I mean, we kind of talked about it. Biostimulator is great. Microneedling, like traditional microneedling is great.
Oh,
that
I
helps
love
to stimulate
microneedling.
collagen, elastin.
Yeah.
Usually want to do a series of those. There's studies on, 300+% increase in collagen elastin after 4 of them. So
how often are you supposed to get that done?
So I tell my clients, you want to do the 3 sessions, usually 4 to 6 weeks apart. We have some that'll come in quarterly, so 3 to 4 months to do it. I always tell people do it twice a year, and then if you want to come in sooner than that, you can.
It's been like a year.
Okay, relax. Your skin looks great. I try to do it at least once a year. Again, but I also couple that with Pixel, like I do our semi-ablative CO2. I do that once a year. So it depends on what we need, what's going on.
Is it 3 times once a year? Or
no,
just after the 3
consecutive,
series,
then it's usually
just one time a year. Mm-hmm. I can do that.
Yeah,
it's doable.
Yeah, absolutely. But it's one of those tried and true workhorse treatments. I think everyone, with the exception of keloid scars, acne, active acne, you're a candidate to do it.
Okay.
Yeah.
And then the second part of her question was, what's your what do you think to get wedding ready?
Okay.
Like, what do you recommend?
Yeah, so I always recommend.
I guess that would be good for like a time frame too.
Yeah, so like time frame is the biggest thing for weddings. You just want to make sure that you're going to your practitioner a year, if just so you can kind of map out where are your big events. Where's the bachelor parties? Where's the wedding showers? So that way we can kind of look at your skin. What are your goals before your wedding? And then we kind of map out. Okay, this is where we'll start. Then you're going to come in to do this. Then you're going to come into this. And then, a month before your wedding, we'll do your final touch-ups. And then the week of your wedding, we do a diamond glow just to get your, exfoliate.
Which I still haven't done that.
Well, you need to.
Yeah.
But yeah, I think you definitely just want to have a plan in place. So that way you're not trying to do it all, the last 6 weeks of your wedding, because then it really constricts what you're able to do.
Okay. Well, yeah. And
you'd be surprised. I mean, I had people that come in 2 weeks before their wedding and they're wanting to do full face of filler. And I'm like, absolutely not. That's not happening.
Oof. Okay.
Yeah. the pressure that I have.
Yeah.
You want me to do what?
Well, and you don't want to.
And that's what I tell them.
Tell people no. You don't want to have to sit them down and give them a talking to.
It's hard. Yeah.
I mean, you can do it to me.
It's funny though.
Because I take it well.
I have gotten to the point where in my career that, I have a lot of come to Jesus talks the second you meet me. And I think that's what people respect about.
So you're setting the expectation in the beginning so they know.
Yes. This is it. And again, with weddings, it's hard. You want to make someone feel their best. Do we want to go in and rearrange their face 2 weeks before their wedding? Absolutely not. So it becomes, this is a doable option. This is not a doable option. And then we come up with what works best for them.
And I think to get wedding ready as well, you don't want to do something that you haven't really done.
Yeah, exactly. And
unless you're, you are trying Botox. But again, like you said, start planning that about a year out and seeing how you like it.
And that's exactly what we will do. Someone that's never had their lips done before, they've really been wanting their under eyes.
Yeah.
We'll do that.
Let's not do that right before the wedding.
Right. We'll do that, 7 months before, make sure they like it, make sure it settles how we want to. And then we'll do that, 6-week touch up to see if they need just a little bit more, 6 months later.
Yeah.
Just to kind of finesse icing on the cake right before the wedding.
Okay.
Yeah.
Perfect.
Yeah.
I think that's a lot of people were wondering about that question.
Yeah, ideally the sooner the better. Get in with your practitioner, have a consultation, discuss your goals, and then you guys can figure out what that timeline looks like.
And then I had one more. He said,
another he.
Carlos, I know you're listening, Carlos. Do you think Jenny should get a lip flip? But then he put in parentheses, hell nah. And I responded, Jenny already has one.
Just did.
So Carlos, I'm wondering,
but Jenny did not get lip filler when she wanted it.
No, I didn't. I wanted to get it last week, and we decided to wait.
Yes.
But I'm wondering if Carlos's question, if he was confusing lip flip with lip filler.
I'm assuming. I would assume. Unless Carlos is just really versed in injectables, because I don't think a lot of men would know the difference between a neurotoxin lip flip and a lip filler.
Well, and I had both, Carlos. So does Jenny need it? Yeah.
No, she doesn't.
Jenny's been doing it. Tell us the difference, though, between
So a lip flip is going to be a neurotoxin. So that's going to affect the muscle movement of the mouth. Traditionally, it's going to keep the lip from everting and turning in. So it's going to avert the top lip. So more of the pink lip shows, essentially flipping it out. Doesn't always work for everyone. It depends on your anatomy, the muscle movement of your mouth.
Yeah.
Most people.
It's so that you don't have that gummy smile.
Exactly. So
and you use Botox
keeps
or Dysport,
the contraction from being so tight that it causes the lip to do weird things.
To curl under like when you're smiling.
And then obviously lip filler, that's to revolumize the lip, reshape the lip, that kind of thing.
Love how it gets out the little wrinkles in the lip.
Yes, hydrate. And a lot of times when my clients are at maintenance, just prime example, you come in, you want lip filler. I'm like, no, we do a lip flip, and that's it. And it gives you a little bit of zhuzh.
I have the distortion.
Well,
I think everyone does at some point.
Well, it's easy to get carried away. It's very easy to get carried away.
I think you need to have your injector be like your accountability partner, and you need an accountability buddy in just a personal friend or a family member.
Life, right.
And I have one. Thanks, Johnny's. And because she said she will tell me, and I've designated her as a friend to tell me if I ever start looking crazy, you better let me know, and she will let me know.
Well,
so, and
what does she say so far?
Nothing.
Okay.
She said it looks great.
Okay, good.
So,
love her.
She's like, you're looking great, Jenny. Keep doing whatever you're doing. Yeah. So,
well,
okay. Well, tell us where we can find you on social media, where we can find Prive.
Our Instagram is Prive Aesthetics. We are on TikTok, Facebook, most, all social media is Prive Aesthetics, Prive Aesthetics.
Prive.
And then my Instagram is Dallas Beauty Injector. That's usually the social media. I'm not super social media active, so.
No, but.
I'm there. I have a presence.
You're very referral based in word of mouth.
I am.
So I am.
And I've been very blessed.
Better.
I've been very blessed in that regard. That is how I've, grown my book of business, grown my clientele. It's been the best organic way to do that. And again, to get like-minded people, I don't have to kind of weed through a lot of the stuff. But we are trying to make a business presence to get more people in the door for our business. And so we do have $50 off for new patients. If you guys want to come in, consultations are always free.
Tell them I sent you so I get referral credit.
And you get referral credit. We do have a loyalty program. We have lots and lots and lots of things.
Great loyalty program. Yeah. Oh, I wanted to also mention before we hop off on this, now Prive has added semaglutide and tirzepatide injections.
Yeah, so we do a compounded formulation of those for weight loss. I've been really excited to kind of start this. We've been doing it a while now. It's not a big advertiser for us.
It was a big decision for you too.
It was.
You did a lot of research before.
We did, and we really wanted to have it in, the best possible capacity for our patients. Taking in. There's so many places you can just get on the internet. You do a quick telemedicine consult. They ship it to your door. Ours is not like that. If that's what you're looking for, don't come to us because it's not going to be like that. We do a very thorough consultation, a very thorough medical history. We take your labs. You're here every 3 weeks. Again, it's a commitment. We're committed to each other. Now we've even partnered with a gym. We've partnered with Recess. And so that we have, discounted rates for people to be able to know where to go. They have trainers, nutritionists that they work with. So
which gyms?
Recess. That's right down off of Mockingbird. So really excited about that. We give a very dense-based, nutrition. We give them the parameters that, they have the ability to map out a meal plan. They have, partnerships with oh my gosh, the prep kitchen, So, and a lot of different things. So excited about that. We're really trying to be all encompassing. It's not just weight loss. It is your full, health and wellness. Yeah. So we're trying to make sure that everyone knows going into, again, we say no a lot to that too. And,
okay. Yeah. Well, and there's places I think that don't turn down anyone. Yeah. I'm really glad that you said that you are doing a full consultation and with your background in nursing as well.
Yeah, we do. I mean, before you can even make it in the door for the consultation, you have to do a questionnaire. And there are hard parameters that just completely nix you. Now, we do take into account a lot of different variables. Again, we don't advertise it a lot. It has been really just our client base. It's been successful and people have been happy about the way that we do it, that now we do get people just for weight loss at this point, which has been great. But we are very by the book. It is your medical care. It's
good to hear because these medications are great, but they can come with serious side effects, and
they come with
if
risk.
A patient is not going to, sometimes they're not going to educate themselves on it. Maybe read up on all the side effects.
Right, you don't know. Yeah. And again, it's up to us as providers to weigh the risk management for you
and their medical history.
And we look at the whole picture and say, is this the right option for you? What are the risks if you do it? And then we make a unified decision on this is it. And where do we draw the line? And so, but we've been really, really blessed that it's been very successful with minimal side effects for us for most of our patients. Yeah. So again, I think that comes with education and making sure that they know that these are the things you have to do to mitigate a lot of those risks and make sure that they're following up with it. So every 3 weeks you come in, we reweigh you, we check in with you.
Okay.
And then
every 3 weeks. That's good.
Yeah. So on your third shot every month, you come back in to get reweighed. We see how you're doing with it. We reorder it, and then we can ship it to your house, or you come back in to get it. So,
good to know. Yeah. I'm glad you guys are doing that now. And
it's been exciting. It's been a good. My big end goal for Prive at some point is hopefully to have a functional medicine side to it, where it really is all encompassing of health and wellness and what I think. And I feel like, again, the way the world is shifting too. So that's kind of the big plan. When that will happen, I'm not sure. That's a massive undertaking to
find the right person too.
And I want someone who's super, super passionate about it. Our doctors are great. They're very thorough, and we love them for that. But they have other things that they have to do. So it's finding someone that is, can come kind of plug and play, and when we have the space to do that.
That's exciting.
Yeah, that's a big goal. We'll see.
Yeah. Well, thank you so much for coming on.
Thank you for having me.
I know I just saw you last week, and I'll see you in 2 weeks.
Yeah, so here she goes. I'm like, Jenny's coming back
today.
So
you're like, what time is it? It's Jenny coming back.
I appreciate that.
Of course. Well, thank you for coming in. I think everyone should try out Prive if you are looking for an injector. I trust Liz with my entire face.
You're so sweet.
And my life.
Sweet.
So I think you're the best injector on the planet. I will never leave you. I'm so loyal. So thank you so much for coming on.
I am who I am because of people like you.
Yes. So. Yes. I love it. Well, thank you guys so much. And
yes, thank you.
Bye.
Later.